Hello guys, and welcome back to my channel. My name is Onyinyechi and I'm a family nurse practitioner. On our channel here, we help nursing students break down these topics that are bothersome in nursing school so that you can understand it a little bit easier. Don't forget to go ahead and subscribe to this channel, turn on your notifications, like the video, and share with others that may find it beneficial. Today we're going to be discussing hypothyroidism, and you already break down the word. Hypo means low and thyroidism just refers to the thyroid. Now, we discussed before that the thyroid gland produces T3, T4, and calcitonin. T3 and T4 help to regulate metabolism in the body, but calcitonin helps to regulate or reduce calcium levels in the body when necessary. So hypothyroidism happens when there are low levels of those thyroid hormones T3 and T4. And since we know that T3 and T4 help to regulate metabolism, low levels of them then lead to decreased metabolism. So let's talk about some of the causes. One of them is one that you see a lot in your class textbooks is Hashimoto's disease. And this is an autoimmune disorder where the immune system of the body attacks the thyroid gland, thereby causing hypothyroidism. Other causes are things like thyroiditis. If you break down that word, you know that thyroid and then itis means inflammation. So thyroiditis is the inflammation of the thyroid gland. Iodine deficiency can also cause this because iodine is one of those elements that is essential for thyroid hormone production. Another thing that can cause this is a surgical removal of the thyroid, radiation for any reason, and then any issues with the pituitary gland because that produces that thyroid stimulating hormone. Now, big signs and symptoms to think about. When you think about signs and symptoms, I want you to match them to the pathophysiology of what's going on. So when you think hypothyroid, we said that's a low level of thyroid hormones. Think slowed metabolism. So hypothyroid, think slowed metabolism. And I want you to think of what a body would do if the metabolism was slowed. So the first thing we have is weakness and fatigue. Patients may also have constipation. Because of that slow metabolism, they're more at risk of weight gain, and menstrual disturbances can also happen. Now, because of the slow metabolism, you may see the patient increased insensitivity to cold, so they're always cold. And another thing we see are dry and brittle hair and nails as well. And they can also have some hyperlipidemia, which can move up with those weight gain and fat accumulation that can come with all of those. So how's the diagnosis made? Diagnosis is made when we see a low T3 and T4, but an elevated thyroid stimulating hormone. And if you think about this, we already said hypothyroidism. We said we already have low levels of T3 and T4. And the body recognizes that those levels are too low for what we need them for metabolism. So that thyroid stimulating hormone continues to stimulate, and its job is to try and get more of the T3, T4 hormones in the body system so we can work on that metabolism. For that reason, we see a low T3 and T4, but we see that TSH working really hard to increase those levels. So we have a low T3 and T4, but an elevated TSH level. So as the nurse, what do you think your responsibilities will be? And these are the things you're going to see on your exam. So I want you to think about those signs and symptoms we talked about, and then match your job as the nurse to those signs and symptoms. So the patient has an increased insensitivity to cold. They're always cold. So as the nurse, you might want to provide them with a warm environment. Now, you know that they are gaining weight because the metabolism is slow, and then they can accumulate and get that hyperlipidemia, which is elevated cholesterol levels. So what you want to do is provide a low calorie, low cholesterol, low fat diet. Now, we also said they're at risk for constipation because the metabolism is slow. So you want to increase roughage foods, high fiber foods, and increase their fluids so that we can help combat constipation. Now, we said they have weakness and fatigue, so you want to provide these patients with adequate rest periods. Now, a big medication to know for hypothyroidism is called levothyroxine, and this is a medication you will see a lot of your patients on. Big thing to remind your patients is that they need to take this medication first thing in the morning on an empty stomach, and they will be taking the medication for the rest of their lives. Now, you will see this question typically on your exams if you get to this chapter, so it's something you really want to try and remember. Now, something I want you to keep in mind is Myxedema Coma, which is a rare but life-threatening condition that can happen when hypothyroidism is left untreated or uncontrolled. And the signs and symptoms are similar to the ones we just talked about, but even worse. So the patient can experience hypothermia, so severely feeling cold, which can lead to changes in their mental functioning, anywhere from depression to unconsciousness. And then that slowed metabolism, really slowed metabolism, can lead to respiratory depression and even cardiovascular collapse. So I hope that this review helps you to remember hypothyroidism in nursing school. Like I said, don't forget to follow or subscribe to my channel. Click on that notification button and make sure you like and share this video. Until next time, thank you for joining me today. Bye-bye.